Good afternoon. Well, it took us some time to get the slides started. Thank you very much for this opportunity to present results of this survey, the European survey that we carried out. Professor O'Connor has spoken about it a lot. I will elaborate on certain aspects. So the effects of the pandemic on mental health. So there's no doubt that we faced a lot of challenges in the wake of the pandemic, and different surveys show that there were some adaptation difficulties, post-traumatic stress disorder, depression, and anxiety disorders in the context of COVID-19. When it comes to stress-related difficulties, traumatologists and practitioners are concerned that there has been an increase in adaptation difficulties caused by the pandemic. Well, for example, earlier in Lithuania, we saw that adaptation difficulties were mainly related to work stress and certain health problems. So on the one hand, we have certain stress factors that have continued for several months now, and we don't know when the situation will change. On the other hand, the factors that would allow us to relax, to reduce our stress are limited. We have no possibilities to travel, so people are forced to look for different ways to help themselves and to resort to non-traditional ways. So we are facing a very significant impact, and we don't know when we'll be able to go back to our usual coping strategies. When it comes to the pandemic and the increase in suicide risk, well, we saw some very interesting results from the study that was presented. And the things like limited contacts and the increasing feeling of loneliness, financial stresses, prolonged anxiety with regard to the possible risk of losing one's job or facing financial problems, then post-traumatic stress and adaptation difficulties. These are all the things that we are observing now. So what are those adaptation difficulties? Well, when people are worried about things that are going on around them, they face difficulties in coping in their daily lives. Well, the first wave of the pandemic in Lithuania was managed well, but when we saw what was happening in Italy last spring, well, we spoke to our colleagues in Italy. They told us how they performed interventions aimed at healthcare professionals because of the burnout of the system, because of the emotional load when they had to choose whom to help. So we know that this is also all this is related to a heightened suicide risk. So we have concerns about possible increases in suicides. We see that scientists around the world are trying to monitor the situation. Some results have dissipated some of our concerns. However, there are surveys which are a cause for concern. So, we carried out a survey in Lithuania, which is called My Wellbeing. You see the Lithuanian name of the survey on this slide. This is a European survey. It was initiated by the European Trauma Research Association. Well, if you are into scientific language and you read English, you can read the results of the survey. Here you can see a link. If not, you can read the same in simple language on the website that you see on the screen. So our plan was to ask people what kind of stresses they're facing, what stresses were most pronounced during which stages of the pandemic, and how they felt. So there are lots of countries that participate. The German team is now leading the research, and they are collating the results and will publish them shortly. So we are looking forward to the publication of the results. Well, the aim was to take into account the situation in different countries. Because countries had different responses to the pandemic and chose to apply different measures. So it will be very interesting and important to compare the results. Well, we used certain measurements during this survey. Well, the professor mentioned several waves of data collection. We had 2 waves. So the first was summer 2020. The next one is planned after 6 months. That is, it will start next week in Lithuania, and it will allow us to see changes in the well-being of people. Well, I can't give you the final results of this survey, but I can say that the first stage involved over 12,000 Europeans. It is an impressive figure, and I believe that we'll be able to present interesting results and issue recommendations on how to help people feel better. This is the Lithuanian team. Well, you usually see the person who presents the result, but that's a false impression that you are getting, because surveys like this require a lot of organizational work. So we had quite a large team. Our assistant, Ms. Nomeikaitė, then psychology students, Ms. Jokubauskaitė and Ms. Anužytė. The consultant of this survey is Professor Evaldas Kazlauskas. Well, and I believe that we are still in the election period, because Paulus congratulated Mr. O'Connor on his election to the association. I, in my own turn, would like to congratulate Professor Kazlauskas, who has been elected as the head of the Psychologists Association. So the results in Lithuania. During the first wave, we had about 700 participants. I will first speak about the things that stood out most. So the results show that about 60% of the participants were affected because of the duration and the risk of the pandemic. 37% were affected by the fear to get infected with the coronavirus, but more than a half were worried that their relatives would get infected. So this is the thing that I hear very often. People are worried about their health, but they are even more worried about their relatives, especially those belonging to the risk group. 49% felt that they were affected by the limited contacts with their close ones. 23% were affected by the loss of income or the risk of the loss of income. 51% experienced heightened anxiety, 38% experienced sadness, and 29% felt moderately or very lonely. Well, when it comes to psychological well-being, 54% of the respondents said that their psychological well-being wasn't good. During the first wave, about 1/3 of our participants fell within the risk group when it comes to depression and anxiety indicators, and about 1/4 of our participants faced adaptation difficulties because of different stressors. So they found coping in their lives, daily lives, difficult. Well, our problem is that we are not following the same sample, so we won't be able to compare the well-being of the same people. But we have a survey which shows that during the previous survey, there were the number of people who are facing adaptation difficulties earlier, before the pandemic, was 8% lower. So this is briefly about the psychological well-being, and now the results related to the suicide risk. So our survey showed that 21% of the participants were at risk of suicide. That risk was very high for 22% out of those 21%. And when it comes to young people, I would like to share one result with you. Our colleague Truskauskaitė Kunevičienė carried out a survey among students, and she had some data from the period before the pandemic and during the pandemic, and she also included the assessment tools for measuring suicidal risk. So she came to the conclusion that there is a higher suicidal risk among students during the pandemic. So, as the professor said, people who experience difficulties in general start feeling even worse during the pandemic. Well, this survey is not yet published. I just simply wanted to share one result from that survey with you. Well, I said that I can't compare our situation with other countries, but I will give one comparison. We included the suicidal ideation attributes scale. Of course, we were not able to include all the scales and all assessments into our surveys, but we worked with our Polish colleagues, and our Polish colleagues decided to assess suicidal thoughts. And we also asked our participants about their suicidal thoughts during the previous month, and we tried to categorize people into those who had suicidal thoughts and who didn't have suicidal thoughts during the previous months. We know that suicide rates are higher in Lithuania than in Poland, but when it comes to this survey, in Lithuania and Poland, we didn't identify any significant differences. So what did we measure? We decided to take into account the factors or the stresses that are related to COVID-19, and that could lead to heightened suicide risk. So we analyzed the fear to get infected. Another factor was limited social contacts and the impact of that. Well, the necessity to stay at home, possibility to leave home and different conflicts related to that, limited social life, well, limited possibilities to go to the places that we like, to travel. We also included another stressor, that is limitations placed on religious practices. We know that Poland is a very religious country, and we know that faith can be related to suicidal risk. So we analyzed this aspect. We also included the indicator of loneliness, risk of adaptation difficulties. We tried to see whether people fell into that category or not, and then decreased income, loss of income. So these are the Lithuanian results, and you can see that the significant value can be attributed to several stressors. That is the necessity to stay at home and loneliness. So the lonelier people felt, the more likely they were to find themselves in the group of heightened suicidal risk. And then adaptation difficulties also were statistically significant. Now, Poland. Well, you can see that the same stresses were important: limited social contacts, staying at home, limited social life, loneliness, and adaptation risks. Well, social contacts in this case is not very, this indicator is not very statistically relevant. We also saw that the inability to leave one's home was statistically relevant, limited social life as well, but that value is negative. So the more difficulties people faced, the less likely they were to find themselves in the group of heightened suicidal risk. So we tried to see what was going on here, and we tried to speak to people, we tried to ask them about the post-traumatic stress. And in fact, many people said that the restrictions that are in place can be helpful to them because there's no need to go anywhere. Some people even like wearing masks, especially those who don't feel comfortable in social life. So we noticed that the more people were depressed because they were forced to stay at home, the more likely they were to fall within the heightened suicidal risk group. The loss of income didn't have any statistical significance, and limitations on practicing religion were not statistically significant either. Well, in Lithuania, this indicator was about 13%. In Poland, this indicator was significantly higher, that is 40%. So there are differences, but in this model, those differences are not statistically significant. So this is the brief presentation of the results. We're going to publish those results. We are continuing our research, our projects. We are now preparing for the second wave, and you will be able to find the results on these two websites that you see on the screen. We have also produced a number of recommendations, and you can find them on the websites too. They are not so much focused on suicide risk. They are more related to general aspects of mental health. So I presented the results from the societal survey, but we have colleagues who are looking at different groups, for example, students, young people, school children, and we have also prepared some brochures, some information leaflets on how to help people during the pandemic, so please feel free to use them, to print them out and to distribute them. So thank you very much for your attention.
Thank you, Odeta, for the presentation. I have one question from the Lithuanian context. Towards the end of the summer, at the beginning of autumn, we had a popular topic in Lithuania that people got relaxed. Can we, based on the data, say that people did get relaxed? Could you specify your question, what you mean by relaxing? Well, does the data show that people relaxed? Because many people talked about people relaxing. That is, people probably not complying with the COVID requirements. And if we speak about the real sense of the word relax, it is hardly possible to judge from that data that people got relaxed, because the anxiety level is really high, and during the first measurement period people did experience many emotional difficulties and anxiety and tension regarding the corona situation. I introduced a couple of results. We evaluated many other things, and the impact was huge in various areas, and there was lots of anxiety. Well, the thing that we call as anxiety is probably the way to look for the methods to overcome the anxiety, and we need to find the ways to counter these stresses, because it has been a long time that we have been fighting this stressor, and people are tired of this, and this is not easy to overcome the stress. Therefore, it may as well be that there are no other ways, and then they come back to their usual habits whereby they start feeling better when there are no alternatives. Like, people need options to cope with the difficulties, but it's not relaxing. It's because people feel more tense and they need something to feel better. I saw the map where the research, the survey is being carried out, and Sweden including. We know that the approach towards curbing pandemics was different, and I wonder what the impact on mental health was. I think we do not have that comparison, or do we? That's an excellent question. I am really looking forward to the results because I'm very happy, and I'm very happy that the colleagues from Scotland managed to implement the study. We do have the Swedish results, but not the calculations. It will be extremely important to analyze that. But actually, the Swedish did more measurement. There were differences between countries, and those countries that felt that their survey participants will survive many more months. They have submitted their results, and a few countries are ready to publicize the results within the scope of 2 years. And when we have the data, the results, we will share them with you. One methodological question. Did you make the selection method for the interviewees in the country uniform? Well, normally this is an independent activity and done on a voluntary basis, and some activities received financial support. We actually didn't have the possibility to interview people physically. Therefore, we spread the information by online channels and other public channels like the social media. The Polish colleagues had the possibility to use their own private company, and they interviewed their participants within a week, and they are using a private company for that. One more question. You mentioned that religion and faith may be related to suicidality. How? There have been considerations that faith has a protective factor. Like, we know that in our faith that suicide is a sin. That means that those people who have faith are somewhat deterred from suicide because it's a sin. And but otherwise, we didn't find any relationship. Well, I think we've answered the questions. Others are just phrases and gratitude to Odeta for a wonderful presentation. I would like to join them. Thank you very much for sharing your study, and we'll look forward to other data and presentations. Thank you, and have a nice conference.